Right now, about half the states in the U.S. have laws regulating naturopathic doctors, and that includes our neighbor to the west in Minnesota. Wisconsin could soon become one of them. That's because a push to have a form of natural medicine recognized in all 50 states hit the legislature this year.
In the past couple of weeks, both the Assembly and Senate have approved a bipartisan bill to license and regulate naturopathic doctors. Our Naomi Coles is here to explain.
This bill creates a regulatory board for naturopaths and recognizes the practice in the state. Now, not all of Wisconsin's main medical groups support it, and naturopathic doctors have been involved in legislative testimony opposing COVID vaccines and basic confirmed COVID science. But that's just a piece of the whole.
Naturopathic medicine is basically primary care that has a natural bent.
Dr. Jill Krista represents the state's Naturopathic Association. The last 3 years, they've pushed hard to be recognized in Wisconsin.
But we're trained with an emphasis on natural medicine and hopefully getting people moved from more high intervention, high cost measures to things that are more in their control.
The bill is bipartisan, but reception is mixed. The Medical College of Wisconsin opposed it. The Wisconsin Medical Society changed from opposition to neutral.
Having a board to regulate naturopaths is a good idea, just like there's a board to regulate doctors.
That's Dr. Wendy Malaska, president-elect for the Medical Society. Their involvement in the bill helped remove the ability for naturopaths to prescribe controlled drugs.
There are a lot of differences between naturopath education and training, whether or not they're accredited or not.
In order to use the title naturopathic doctor, you have to go to a naturopathic medical school, which is a 4-year bachelor's degree. And then there's a graduate level education.
There's a mixed reaction in the naturopath community to COVID vaccines. Recently, a naturopath doctor testified to a legislative committee that he discouraged COVID vaccines for nearly all his patients.
And for any of us to think vaccinations or masks or any of this is going to get rid of it, I don't think it fits any of the science.
For the majority of patients, would you say that they would fit? You would recommend the COVID vaccine for them?
Yeah, that's kind of a conversation for another day.
You don't want to paint anybody with one broad brushstroke and say that, all naturopaths, don't support vaccines and don't support mask mandates, because there are some that do.
Ultimately, Dr. Malaska says there's a place for natural remedies.
The traditional view from most medical doctors is that there's kind of a place for it, but a limited scope of practice.
I asked the governor's office whether Evers plans to sign the bill. Now that it's cleared both chambers of the legislature, they didn't respond.